So, Sarah Stern is a person who equally uses her eyes and her brains in her work, often serving as a visual design thought partner for experts conveying complex health topics. She is a health communication designer at Open Notes and was on the publishing team for Emily Peters' Artists Remaking Medicine. She has always worked from pieces of her lived experience that feel raw, including her almost 20 years living with chronic illness. Her career has been defined by finding her own story and understanding how it relates to others, then determining what can be done together to create positive change. Sarah, please tell us about your work.
Hi, everyone. Thank you, Dawn. Thank you so much for having me, Denise and Dawn and Jennifer. I'm going to be sharing a deck and talking a little bit about my design work. So I'm a health communication designer. This is a term that you may not have heard before. I'm in a niche that is very special and unique to my background and my education. I've worked with clients like AARP, Mayo Clinic, Phillips Foundation, CDC Foundation, Pew Charitable Trusts, and Harvard Medical. I'm going to talk about what it means to be a health communication designer and how I got here. So it all started with my patient story. Um, Dawn mentioned that I've spent about 20 years as a chronic patient. I was first diagnosed at age 17, and the person who was figuring out, sifting through all the health information, having the hard task of trying to figure out what to do was my mother. And my mother had to make decisions like what medication I should be on at age 17 that I would probably be on for the rest of my life. And some of these medications I ended up going off of later, caused many side effects. And some of this decision making I didn't really take on as a minor at the time, but wonder what it would have looked like if I was looking for that information at the time. So when I did start to take on some of this burden and sifting through health information and engaging with health brands and looking at apps and trying to find the right ones that I would use, which I now think a lot about as a designer. I was about 26. I became an autoimmune patient and I started getting infusions regularly. And this on the left is a picture of my cat, Star, and one of the side effect sheets for my black box infusion. And you've probably seen side effect sheets like this before. They are tiny print, really hard to read, just made for compliance so that we know that we could die or get cancer or whatever else from this medication. And as a designer, I sort of questioned that method. I thought maybe patients should know what they're getting into. Maybe this should be designed in a way that's readable, that's understandable. And also maybe people with PhDs and people with MDs would prefer that kind of presentation as well. So I became really interested in the presentation of health communication. This is my science dictionary that I'm armed with, and lots of books and lots of learning about how to present information in a more digestible way visually. So I'm going to talk about one of my offerings at With Care Creative, which is information design. And I just define this pretty broadly. Information design typically is data visualization, infographics, which is usually the core of what I'm doing in information design, but sometimes I'm putting them in a report for people, or I'm working on them in the context of a presentation, or I'm working on social media carousels to explain something simply that is a complex health topic. So that's the kind of work I'm going to be talking through today. But I also do brand design work. I also do digital design. But I want to just narrow in on this specific service. So I work with Open Notes as a health communication designer, and Open Notes is a research institute affiliated with Harvard Medical. We study patient portal usage, older adult digital health literacy, how care partners can become proxy members of their patient portals, and how that helps outcomes. And we publish a lot of papers. So my role is often sifting through these papers. And this is actually a very nicely designed paper. They're not all this beautiful, but got nice headers. It's got some visual hierarchy. So I take all this information. Oftentimes I'm working with AI, and oftentimes I'm questioning AI. What page did you find that on? to find the most salient points in the article that I can then translate for the team for PowerPoints and for social media. So this would be what a PowerPoint slide might look like. I've taken out some top hits, their top stats from this paper. There's a little bit more information underneath, and this is sort of a taste of what someone might expect from the paper, just a teaser to get people to want to read more. And that's often what I'm doing. I'm trying to attract people to a number or a fact or just a little snippet to get them interested. This is what it might look like on social media, a social media carousel. So you would slide through these slides. I'm going to show you what a report looked like for a health information exchange in Vermont, and just sort of talk you through how, as a visual designer, I would approach a data visualization to make it more readable and understandable. So this is what the client gave me. This was for their annual report. The type hierarchy, and when I say that, that means what is the header? Is it readable? Is it more noticeable than the rest of the text? How many different fonts are there? How many different sizes are there? This is kind of messy. The two graphs don't really sit well on the page together. There's a lot of different font sizes. So after, and also this donut chart on the right, it's very hard to see what is the most money, what is the second most, what is the third most. There's just a lot going on here. So when I edit it, I'm looking to create that clean, polished look that someone wants in their annual report, which is probably being read by people who care about money, and make things really polished in that way for that audience. And then this is a research paper through a content marketing agency focused on healthcare that is about plain language, which I love to talk about. So they did this study on whether plain language is preferred by people with MDs, people with PhDs, and found that it's not just patients who want plain language, it's everyone because it's more understandable. So this is an example from that report. There's tiny, tiny letters you can't really read. There's huge ones that look kind of goofy. And you're kind of comparing the very likely and the somewhat likely, but that's not the point of what this chart is trying to say. This is trying to say that plain language is more important than not plain language. So what I'm doing is just simply looking at color, looking at type, and making it really clear that plain language is what we care about here. The warm colors come forward. Everything is cleaner, polished, great for a presentation. So that's the kind of work I do. I mentioned I also do brand design. Happy to share more about that. And this is my website if you would like to check it out. My offer is if anyone has a figure or a diagram that they're working on for a paper, a book, an article, I'm happy to take a look at it and tell you how I would make it more clean and polished and ready for publication. And my ask is just to share my website around with someone that you think might need design help in the health sector. Thank you.
Great. Thank you, Sarah.